right. Hi, everybody. My name is Christine. I'm a nurse practitioner and I specialize in menopause, and I'm also a weight loss expert. If this is your first time joining me, go ahead and like and subscribe to my channel so you can continue to get more education and support in these areas. Today, I just wanted to talk a little bit more about menopause and really what to expect during this transition. I find for a lot of women, we're, even just confused as to what is normal during menopause and what is perimenopause, right? So really just starting there and really covering the basics with menopause and what you can expect. So important to be educated so that you know your treatment options. All right. So, who am I? Again, my name is Christine. I'm certified through NAMS as a menopause provider. Previously, in my past life, I was a lieutenant in the Navy, and I specialized in labor and delivery and postpartum. So I served active duty. And when I got out, I finished my degree as a nurse practitioner, graduating with my master's from George Washington University. And I've spent several years working in the telehealth space at all of the top companies in this area. And from that experience, I decided to launch my own telehealth company, really combining both menopause and that weight management expertise and bringing, of course, that evidence-based practice to a space that a lot of times kind of feels a little scammy, right? And so my mission is to both empower women, but also to educate them so they can make confident decisions about their own body. All right, so today, just understanding what is menopause, what is that transition, and what to expect. And then, talking more about some of those treatment options and what that might look like. Oh, and I forgot to say, I keep doing that. So I forgot to say, I'm the founder and owner of Empowered Women's Telehealth. And so we are located here in Austin, but I have licensed in states all over the country. So yes. All right. So, why should we even talk about menopause? Well, women will spend a third of their life in postmenopause. And, there's also the years leading up to menopause. That transition period, known as perimenopause, can last up to 10 years. That's really a long time to have your symptoms ignored or to, not get treatment. And it can really affect the quality of your life. And so, again, just the empowerment through understanding, right? So, education about what this looks like so that you can confidently manage your symptoms effectively and breaking that stigma around menopause. So, journey through menopause, the first phase is perimenopause. It can last up to 10 years, and it's marked by the fluctuation of estrogen. So, as opposed to like low or high, right? It's that fluctuation. So, think of it as kind of like going back and forth. Some days you might be high, some might be low, and it's that turbulence that really causes those symptoms. And that can start, for some, I'm 39, I'm experiencing it. But others, typically early 40s or in that 40 phase. And those symptoms can really vary, and so can that duration. So it's going to be unique and different for everybody. Menopause, so that's defined as 12 months without a period consecutively, right? And so, I'm not talking about skipping periods. I mean, like 12 months continuously without a cycle. And then postmenopause is finally that phase. Once you've gone 12 months without a period, then the remaining of your life is in that postmenopause phase. Generally, hormones tend to stabilize, and symptoms for most women, won't say everyone, will improve. Unfortunately, that usually doesn't apply to those vaginal symptoms like vaginal dryness and painful sex. All right. So again, this just kind of reviews the different phases that you go through. So starting with perimenopause, often the first symptom in perimenopause is changes to your menstrual cycle. So that's usually what we'll see women present with, wondering if they're starting to go into menopause, they're starting to skip cycles. And other changes could be, longer or shorter durations in their cycle, heavier periods or lighter periods. So usually a good first step is just to start tracking your period and see what you're currently doing as you start to skip cycles. So when you're skipping 2 to 3 months at a time, we usually consider this late perimenopause. All right. I liked how this graph really illustrates that the bulk of the symptoms are going to be in that perimenopause phase, right? So that transition phase. I don't know about you, but I often thought menopause was like, you stopped having your period and then you had symptoms, right? But that's really not what happens for most women. The symptoms are going to present during perimenopause, so during that transition phase, which again can last up to 10 years. And so it's going to be different for everyone. We all hear about the hot flashes and night sweats. But for you, maybe it's sleep disruption. You're just not sleeping as well as you used to. Or maybe it's mood changes. One of the top things that women will search during this period is menopause and angry at husband, right? And so if you have a history of depression, once you go through menopause or you start that transition, you're at increased risk for depression. And there's also, the anxiety piece too, right? And so, for some women, it's more the mood changes that are really troublesome. And then, of course, these symptoms continue through menopause and then they start to level off for most women. There are unfortunately some that will continue to have symptoms in postmenopause, but generally they do tend to level off. Now, something that I like that this graph also shows is that, the estradiol level is starting to fluctuate in that transition period as it declines, eventually becoming low in postmenopause. And you can also see the FSH start to increase. Generally, it's late perimenopause that you might catch that elevated FSH level. But, if your FSH is normal, that doesn't mean you're not going through perimenopause. It can be normal at that one point in time when you check it, and you can still have symptoms of perimenopause. Because if you look at the estrogen levels again, it's that fluctuation of estrogen that's really contributing to the symptoms. And so, sometimes lab values just don't tell the whole story, right? All right, so common symptoms of menopause. This just highlights some of the more common ones, but there are really a lot of potential symptoms. And I won't exhaust that full list with you. Most of you have heard about the hot sweats and hot flashes and night sweats. But again, those mood changes, sleep disruption, fatigue, weight gain. A lot of women talk about the menopause belly, right? So increased abdominal fat. And that has to do with the fluctuating or low estrogen levels. And your body starts to redistribute where fat goes, and it will place it in that abdominal area. Vaginal dryness or, any kind of vaginal irritation, and painful sex that often presents in brain fog. So if you've ever been through postpartum period, you experience a lot of these symptoms due to those hormonal shifts. And so this is just, another way that you might relate to, oh, yeah, I went through that during postpartum, and I'm starting to have some of these symptoms now that I'm going into perimenopause. Okay, so hormone therapy, what is it? So there are FDA-approved treatments for menopause that are safe and effective, and we'll talk about who should be on hormone therapy and who should not. So they can help relieve those bothersome symptoms like night sweats and hot flashes and sleep disruption. We have both systemic hormone therapy and local vaginal therapy for like vaginal dryness. Indications, FDA approved indications would be night sweats, hot flashes, treatment of osteoporosis prevention, I should say, not treatment of, but prevention of osteoporosis. So if you have that family history, then, hormone therapy would be indicated. And then, anyone who starts menopause before the age of 40, that's a whole other condition and does require hormone therapy treatment. So hormone therapy should not be used for prevention of chronic diseases. It shouldn't be used for the treatment of osteoporosis, prevention of aging, or treatment of primarily aging-related conditions like skincare. Menopause is a natural stage of life, so it's not a chronic condition. And that said, a lot of women do suffer during this transition. And so, you deserve a provider who will listen to your symptoms and discuss treatment options with you. And so, again, varied symptoms, there are a lot of potential symptoms in this phase, and we've only really talked about, some of the more common ones, but it's unique to everybody. So if your, experience of menopause doesn't match what your friends is, that's okay. Everyone's different. And so that menopause journey is going to be unique to you. And then, proper evaluation. So you can go to the NAMS directory and find a certified menopause provider in your area. I usually recommend selecting telehealth. You're going to get more options that way, but you can also look, locally, even in your zip code. All right, so risks versus benefits of treatment with hormone therapy. So, obvious benefits of treatment would be improving those symptoms, relief of your menopause symptoms like hot flashes and night sweats. But then also, it helps to prevent osteoporosis. It does, it's shown to improve cardiovascular outlook, but also shown to decrease the risk of developing diabetes. So there are a lot of other benefits other than just treating your symptoms. Now, risk of treatment for certain groups, you are going to be at increased risk. So the older you are, the higher these risks are. In general, if you're under the age of 60 or 10 years since your last cycle, then, for this group, benefits outweigh risks. So we'll go over these risks a little bit more, but they're generally very low for that population. But this is why, the clot risk and the breast cancer risk, this is why it's not recommended for women over the age of 60 or 10 years since your last cycle. Now I have a low dose option here. This is referring to vaginal estrogen therapy. There's like relatively no contraindications for this treatment. So even for women who are older that can't qualify for systemic hormone therapy, they can still qualify for vaginal estrogen therapy. And I have over here on the side, like reasons to pick the estrogen patches over the pill. So for that, the patches are not metabolized by your liver. So it bypasses that liver where pills are. And so when pills are metabolized by the liver, that's what increases your risk for blood clots. And so by going the patch route, you're have lower risk of blood clot. So we have a lot of really great observational studies that support that. All right. So again, general risk very low, benefits outweigh the risk when used in women under the age of 60 and within 10 years of their last menstrual period for bothersome symptoms. And that risk of stroke and blood clot really increases with age, so not recommended for anyone over the age of 60 or more than 10 years since their last period. Dementia, there may be an increased risk for someone starting after the age of 65. And then breast cancer, there's a slight increased risk for combined hormone therapies for more than 5 years, or just estrogen alone used for so after 7 years. So, does hormone therapy cause cancer? This risk is really low. We can't say it's zero, but it's very low. It's one additional case per 1,000 women per year, or 3 additional cases per 1,000 women over 5 years. And the recommendation here is those annual mammograms. So whether you're on hormone therapy or not, getting regular mammograms. You'll see some guidelines say every 2 years, but especially if you're on hormone therapy, getting that done every year. Since the WHI study about 20 years ago, hormone therapy has been extensively studied, and benefits include improved cardiovascular health, reduced osteoporosis fractures, better sleep, and increased energy. So the WHI study had a lot of flaws to it. The main one is that most of the women in the study were over the age of 60. And so this is really where the timing theory comes from, that it matters when you start hormone therapy. So that's where for that population under 60 or less than 10 years since your last period, risk generally low. So who should not use hormone therapy? Anyone with breast cancer history, uterine cancer, liver disease, history of blood clots or cardiovascular disease, and unexplained bleeding. So unexplained bleeding shouldn't be unexplained for long, right? You should be seeing your OBGYN to have a transvaginal ultrasound and get that investigated. And so you can see like the contraindication list is actually very small. And then vaginal estrogen therapy, again, virtually no contraindications for that. So it's generally safe for most women. And then working with healthcare professionals, it's really important as we age to continue to get those annual visits. If you have health insurance, it's covered. And so during menopause, there are certain conditions that become more common, like hypothyroidism, tend to see changes in your cholesterol panel. And then as we age, we tend to gain weight. And so that can come with additional concerns, right? And so if you're in that overweight range or obesity range, higher risk for conditions like diabetes. And so you might start to see changes in your A1C, indicating potentially metabolic syndrome. And so, also checking your blood pressure, making sure it's with a normal range. I know we often think of heart disease and heart attacks affecting mostly men, but it's actually women. So more women die from heart attack than men. And so it's really important to make sure you're getting those annual visits in. And then working with a menopause certified provider. So if you're not finding your support with OBGYN or your primary care, working with a menopause certified provider is a really great option. They're just going to be experts in this field where typically I think it's like 30% of OBGYNs get any formal training. Most don't feel comfortable treating menopause, and it's even lower for family practice or for primary care. And creating open conversations. I'm really big on hosting different spaces, whether it's like a community event or podcasts where we can continue to, have menopause not be a stigma, no shame, like just sharing our experiences so we're not alone. So, keys to understanding hormone therapy, there's going to be a trial and adjustment period. It's kind of like if you've ever taken depression medication, you don't start it and then feel great the next day, right? There's a period that you have to wait. So, usually like 4 to 6 weeks. And then we do a reevaluation to see if that treatment plan's working. But it can take up to 6 months before you feel the full effect. Most women start to notice improvement in sleep first. And then, looking out for any side effects that you're experiencing. It's like birth control. There's a lot of customization here. If your current treatment's not working for you, again, this is where talking with an expert, you can find a different approach that treats your symptoms without the bothersome side effects. Stopping hormone therapy, we used to say you have to stop after 5 years. That is no longer, that's just not evidence-based. It's not the guidelines. This is going to be individualized when you should stop. And it should be like a collaboration. Like it shouldn't just be your doctor telling you should stop hormone therapy now, unless you had a stroke or you have one of those contraindications that makes it no longer an acceptable treatment. All right, so key takeaways: staying informed is really important in this space. Finding good resources is going to be key to know if you're getting correct and up-to-date information. I included this book, The Menopause Manifesto by Dr. Jen Gunter. She's an OBGYN and a real advocate in this space. She also writes the Vagenda, which is a really great blog and resource. And then, of course, there's always NAMS. You can go to their website and they have a patient education section that will answer a lot of common questions. I included a free menopause resource here, as well as the link to the NAMS Mino Notes that I really like. They're just like PDF copies that you can go through. Again, I'm just talking about some of those common questions in menopause. This will take you to a PDF that you can, print off if you want, and it has like trackers in there. So you can track your symptoms, you can learn more about menopause and tips on how to manage it. All right. Well, that's it. Thank you, everybody, for joining today. I included my name and my email and phone number in case you'd like to reach out. I do offer free consultations if you just want to know if maybe you're in menopause or if hormone therapy is right for you. And here are my references for the presentation today. So I do attend their conference every year just to stay up to date. And if you want to also review the guidelines yourself, I recommend the position statements. So there's the NAMS 2023 and 2022, and that's going to be your best resource for what is both evidence-based and first-line treatment for menopause. And so it's a great option if you're just not sure if what you're hearing maybe from your provider or on social media is accurate, then you can go to that to see, well, what's the standard treatment? And that is it. So thanks again. I hope you like and subscribe to my channel. And be sure to check us out on our podcast called Empower Her, where we continue to talk about menopause and weight, but also other issues that have to do with like women's health. And so we're going to start having more experts on the podcast. We're currently like a panel of 3 menopause experts, but we're going to start doing more interviews to talk about other areas like pelvic floor therapy. So anyway, if you found this helpful, leave me a comment. If you have questions, let me know and I can talk about it in my next presentation. Right. Thanks. Bye.